All right, so let's continue with chapter 2. We spoke with muscle fibers and the different types of muscles. Now let's go to the definition or some more muscle terminology, and we'll start with the origin. Now the origin, structurally, the proximal attachment of a muscle or the part that attaches closest to the midline or center of the body. And functionally, that's the least movable part. So if you look at this, here is the origin of the biceps, right? The long head and the short head. But the key here is it's the immovable part. So the insertion is what actually moves. So when you contract your biceps, you see how the insertion comes closer to the origin. And depending on the type of exercise you do, that will affect, are you going to get more of the elongated look, or are you going to get more contraction, etc., etc. And we'll talk about the difference between isometric, isotonic, eccentric exercises. But for now, just know what the pure definition of origin is. So it's the proximal attachment, and usually it's the least movable part. Now the insertion, of course, is the distal attachment, or the part that attaches furthest from midline. And historically, it's the most movable part. Okay, so if you look at the origin here, and we look at the insertion point here, this is the biceps femoris. Now, so an example, let's take an example of the biceps curl exercise. You guys probably do the biceps curl exercise. And at the end of this chapter, I'm going to tell you the best EMG studies based on EMG data of what are the best exercises for biceps, what are the best exercises for your back. So it's going to be great as we put it all together from a neuromuscular standpoint. So the biceps brachii muscle in the arm has its origin, least movable. Okay, so remember the origin means the least movable bone on the scapula, and its insertion, the most movable, on the radius. So in some of these movements, it can be reversed, and of course, we can talk about those a little bit later. But the pull-up, let's take that. So the radius is relatively stable, and the scapula moves up. The biceps brachii is in the extrinsic muscle of the elbow, and the brachialis is the intrinsic muscle to the elbow. So that's the pull-up. Okay, so from a muscle origin insertion standpoint, let's look at the bicep curl. When you do a bicep curl, of course, the origin stays the same, right? It doesn't move, and your elbow flexes. Well, same thing with the pull-up, right? The origin stays stable, and the radius, right? Radius is relatively stable, and then as you flex, what happens is the origin and the insertion get closer. Okay, so let me show you a video, KenHub, great video that shows you some muscle terminology. And sometimes you guys use arm and the same as forearm, but there is a difference, and thigh versus leg, or leg. So sometimes you guys use the wrong terminology. So let's clear that up first. All right. So what are the types of contraction, right? So contraction, the definition is when tension is developed in a muscle as a result of a stimulus. The term muscle contraction may be confusing because in some contractions the muscle does not shorten in length. So that would be an isometric. Okay, so as a result, it has been increasingly common to refer to the various types of muscle contractions as muscle actions. So you're doing an action. So you don't always want to use contraction because, again, isometric, you're not really contracting. It's just tension. So let's look at this. Muscle contraction can be used to cause, control, or prevent joint movement, to initiate or accelerate the movement of a body segment, to slow down or decelerate the movement of a body segment, and to prevent the movement of a body segment by external forces. So that's why we can have muscle contraction. So when you do a plank, you're not really contracting. You are preventing the movement of a body segment by external forces. Maybe you're slowing down, decelerating, or are you initiating or accelerating the movement? You're probably preventing the movement of a body segment. So all muscle contractions are either isometric or isotonic. And being able to know the difference between isometric and isotonic is definitely something that will be on the quiz. So active tension is developed within the muscle, but joint angles remain constant. Okay, that's an isometric contraction. Also thought of as a static contraction. A significant amount of tension may be developed in a muscle to maintain the joint angle in a relatively static or stable position. May be used to prevent a body segment from being moved by external forces. So isometric contractions are definitely beneficial. When you sprain your ankle, you can start with isometric contractions, and that would be a good way to start off with, and then gradually build your way up. Isometric contraction, biceps brachii contracting muscle, that's isometric. Okay, so the biceps is isometrically contracting, but the triceps is not. Muscle contracts but does not change length. Now in this, when you're pulling it down, again, you're not changing length, but you're still developing an isometric contraction. So that's like if you were just flexing, right? That would be an isometric contraction. Now, an isotonic contraction involves the muscle developing active tension to either cause or control joint movement. Dynamic contractions. The varying degree of tension in muscles result in joint angles changing. So that can be either concentric or eccentric. So those are subdivisions of an isotonic contraction. But the definition of isotonic is involve the muscle developing active tension to either cause or control joint movement. And remember, I emphasized early on that eccentric exercises are the most beneficial in preventing preventing injuries on the basis of whether shortening or lengthening occurs. So let's take a look at here. Movement may occur at any given joint without any muscle contraction whatsoever. That's referred to as passive, slowly due to external forces such as those applied by another person. So let's say you had a rotator cuff injury and the doctor just did surgery. Well, for the first 4 to 6 weeks, we might just do passive range of motion where the therapist or the athletic trainer may just passively move it where the patient is not actively moving. Let's say you had a knee replacement or ACL surgery. Maybe for the first 2 weeks, they only want you to do active or passive. Passive, because they don't want you to actively flex, especially if you had a hamstring graft. Okay, so they don't want you to contract that for some time. So it depends on the protocol. Now, concentric contractions involve a muscle developing active tension as it shortens. That causes motion. And eccentric contractions involve the muscle lengthening under active tension. That's controlling motion. So concentric causes motion. Eccentric controls the motion. So think about a baseball pitch. You need to control that motion so you don't cause injury. So eccentric control is very beneficial. And we'll look at a video that shows the difference between a concentric and an eccentric contraction. So going back to concentric contraction, muscle develops active tension as it shortens. Occurs when muscles develop enough force to overcome the applied resistance. Causes movement against gravity or resistance, described as being a positive contraction. Accelerates movement. So look at this. This is 10 kilos, right? So about 22 pounds here. In order for a concentric contraction to occur, you have to overcome the 10 kilos. Otherwise, you're not going to. If you just match the 10 kilos, it's going to be an isometric contraction. So your force has to be greater than 10 kilos in order for it to cause a concentric contraction. Hope that makes sense. Force developed by muscle is greater than that of resistance. Results in the joint angle changing in the direction of the applied muscle force. Causes the body part to move against gravity or external forces. Now, in eccentric contraction, muscle lengthens under active tension, occurs when muscle gradually lessens in tension to control the descent of resistance. So think about going up and down stairs. Okay, so going up the stairs, you are doing a concentric contraction of your quads to go up the stairs. But in order to come down the stairs, you need to lengthen the quads and control the descent. So that would be an eccentric contraction. So going down the stairs, you actually need more strength than going up the stairs because you have to actively decelerate that motion. Okay, so weight or resistance overcomes muscle contraction, but not to the point that the muscle cannot control descending movement. So it's very important to train eccentric contraction, eccentric control when it comes to injury prevention. It's one thing to be able to contract, but actually it's more effort and more neuromuscular control to decelerate and slow down the motion. So think about running uphill or running downhill. Running downhill is actually more difficult because you have to decelerate that motion and use eccentric control. So again, if you take a look at the eccentric contraction, the biceps brachii contracting muscle, so it's got that 10 kilograms, right? It's contracting it, but then it's slowly letting it down versus it just letting drop down. So same thing with the triceps. It's contracting, but then the movement is slowly bringing it back to the starting position. So that's eccentric control. Controls movement with gravity or resistance, described as a negative, right? So negatives, you've done bench press, right? You do a negative where you slowly lower that down. You don't just bounce it off your chest. So the negative, if you do a day of negatives, you know that, hey, you get pretty sore on that day. And if you want to build strength and build control, do negatives at least once a week, and you'll get some good results. They actually have done research where if you want to build girth, eccentrics is the way to go. So the lowering phase, the negatives, you'll actually build more girth. Force developed by the muscle is less than that of the resistance, so results in the joint angle changing in the direction of the resistance. Eccentric contraction controls the body part to allow movement with gravity or external forces upon, and used to decelerate body segment movement, referred to as a muscle action instead of a contraction because the muscle is lengthening. You're not really shortening in an eccentric, so you want to call that a muscle action, not a contraction. Now, isokinetics is a different type. It's a type of, so you've heard of the Cybax machine or the Biodex machine. I'll show you a video of that. But those are examples of isokinetics. You guys ever watch Rocky IV? You ever see the Rocky IV training montage? So I'll show you that. Ivan Drago, he used the Cybax machine, and it's pretty good. How many have not seen Rocky IV? What? It's crazy. All right, so a type of dynamic exercise using concentric and eccentric muscle contractions. Speed or velocity of movement is constant. Muscular contraction, ideally maximal contraction, occurs throughout the entire movement. So another type of contraction, as some have described. So we'll check out, let me show you a Biodex and a Cybex. Various exercises may use or any one of these contraction types for muscle development. So you can set the speed and the resistance on a Cybex or Biodex with good results. Now let's take a look at agonists versus antagonists. Now, agonists cause joint motion through a specified plane of motion when contracting concentrically. It's known as primary movers or muscles most involved. So some agonists, because of the relative location, size, length, or force generation capacity, are able to contribute significantly more to the joint movement than other agonists. So if we're doing a bicep curl, right, your agonist is your biceps brachii. Your antagonist would be your triceps. So there's assisters or assistant movers, agonist muscles that contribute significantly less to the joint motion. Consensus among all authorities regarding which muscles are primary movers and which are weakest does not exist. So when, let's say you're doing a bicep curl, well, the main agonist might be the biceps brachii, but some will say, oh, the brachioradialis is also an agonist, and you're right, it's an assist in elbow flexion. Now the antagonist is located on the opposite side of the joint from the agonist, have the opposite concentric action known as contralateral muscles, work in cooperation with agonist muscles by relaxing and allowing the movement. When contracting concentrically, they perform the joint motion opposite to the agonist. So example would be the quadriceps muscles are antagonists to hamstrings and knee flexion. So when you bend the knee, the hamstrings are the agonists, but the quadriceps are the antagonists. But when you do a knee extension exercise, then the quadriceps become the agonist and the hamstrings become the antagonist. So remember these examples because they'll show up on the quiz, what's an agonist and what's an antagonist. Now you have obviously have stabilizers, and when we come to talk about the rotator cuff and shoulders, you have a lot of stabilizers. They surround the joint or body part. They contract to fixate or stabilize the area to enable another limb or body segment to exert force and move. They're known as fixators. Essential in establishing a relatively firm base for the more distal joints to work from when carrying out movements. So we like stabilizer muscles, especially when it comes to rotator cuff and overhead athletes. So let's look at biceps curl. Muscles of the scapula and the glenohumeral joint must contract in order to maintain the shoulder complex and humerus in a relatively static position so that the biceps brachia can more effectively perform curls. Now think about when you go to the gym, you see some people doing those bicep curls. They're just all over the place. You know, they're swinging their body, they're doing everything to get that 30 pounds up, but really none of that other stuff should be moving. Those should all be stable, and the motion just come from the origin insertion. So you know you have too much weight if you end up swinging your entire body to get that weight up. It's actually better to drop the weight a little bit and have a control of that motion. So antagonists for each motion of the proximal joint contract or contract against each other to prevent motion. This is an example of proximal stabilization to enhance the effectiveness of distal joint, which occurs commonly. So remember, you want proximal stability for distal mobility. I love that saying, proximal stability for distal mobility. So the more stable your shoulder is, the more stable your scapula is, you're going to have greater distal mobility. So from a pitching standpoint, overhead athlete standpoint, shot put, whatever the case may be, you want good scapular and proximal stability. And I'll show you the best from an EMG standpoint, which are the best stabilizers for your upper back and mid back. Now, what is a synergist? Assists in the action of the agonist, not necessarily prime movers. They're known as just guiding muscles. Assist in refine movement and rule out undesired motions, and they may be helping synergists or true synergists. So when you do your case studies of the different exercises, I want to know which are the agonists. I want to know which are the antagonists, which ones are the fixators, which ones are the synergists, and that way we learn as a class all the muscle groups, because it would be silly for me to go through every single motion and every single muscle in the body. I just couldn't do it. But when you do your projects, we'll definitely go over that. Now, the role of helping synergists, they have an action in common, but also have actions antagonists to each other. They help another muscle move the joint in the desired manner and simultaneously prevent undesired actions. Example, anterior and posterior delt. Okay, so they work together. The anterior delt acts as an agonist in glenohumeral flexion, while the posterior delt acts as an extensor. Helping each other, they work in synergy and the middle deltoid to accomplish abduction. So the middle delt, the anterior delt, and the posterior delt, they all work together. Now what happens is if you don't have a balance, then what it's going to do is it's going to drive the glenohumeral joint either anterior or posterior, and you're going to get impingement, especially in overhead athletes. So you need to have a balance of the anterior and posterior delt and middle delts. And we'll talk about the best exercises. Most people lack posterior delt strength. There's a lot of anterior delt exercises, but most people lack posterior delts. All right, a true synergist contract to prevent an undesired joint action of the agonist and have no direct effect on agonist. Example, finger flexors are provide true synergy by wrist extensors when grasping an object. Finger flexors originate on the forearm and humerus, are agonists in both wrist flexion and finger flexion. And then wrist extensors contract to prevent wrist flexion by finger flexors. This allows finger flexors to maintain more of their length and therefore utilize more of their force in flexing the fingers. So again, finger flexors are provide true synergy by wrist extension when grasping an object. Both of them, the flexors and the extensors, have to work together in order for you to get a good grasp on the object. Otherwise, you'll fall flat on your face. Okay, and what are the neutralizers? Well, neutralizers counteract or neutralize the action of another muscle to prevent undesirable movements such as inappropriate muscle substitute, which is referred to as neutralizing. So contract to resist specific actions of other muscles. So let's say, example 1, when only supination action of the biceps brachii is desired, the triceps brachii contracts to neutralize the flexion action of the biceps brachii. Now, when you do a biceps curl, when only the flexion force of the biceps brachii is desired, the pronator teres contracts to neutralize the supination component. So remember, when you do a curl, you can supinate, like do that little twist, and in order to prevent that twist, the pronator teres would have to be active in order to prevent that. But if you want that nice rounded look, then you want the supination action. There's a lot of force couples in your body. Force couples occur when two or more forces are pulling in different directions of an object, causing the object to rotate about an axis. And the most famous force couple would be in shoulder, and I'll show you a nice little video from Donatelli. Coupling of the muscle forces together in the body can result in a more efficient movement, so this is very important to have efficient force couples. Example would be your mid trap, lower trap, and serratus anterior, each pull in the scapula from a different direction. Now, if you have weak middle traps or weak lower traps, the serratus might overpower the middle traps and you get that rounded shoulders. So we definitely want to have a balance of middle trap, lower trap, and the serratus. So here's a good example of middle trap, lower trap, and the serratus. Those are all force couples working on the scapula. And let me show you this video here.